Good afternoon, everyone. This is Russ Harrison, IEEE-USA's Director of Government Relations in Washington, D.C. This is, I believe, our fifth COVID Washington update. And what we want to do this time is focus a little bit on what the states are doing. As the country has established over the last couple weeks, most of the responsibility for responding to the pandemic falls on governors, not necessarily people here in Washington, although people here in Washington have their role. And so we're going to talk through a little bit about what the states are doing and how they're approaching this now that differences in the states are starting to emerge. Start with our view of the economy. This is what we're seeing, and this is what Washington is responding to, other than the pandemic itself, of course. Air traffic is down about 97%. There was actually an interesting letter that was released by the CEO of United last week, and it was sent to employees, but it's public. And talking about the particular situation that United finds itself in and analyzing the things that United is dealing with. One of the things the CEO said was, United expects to move as many passengers in May of this year as they did in any given day of May last year. And that's the level of contraction in that particular segment of the economy. Something like 90%, report out a week or so ago, 90% of restaurants have laid off staff. About half of restaurants in the country are facing bankruptcy. There were 4.4 million new unemployed Americans last week. Now that is 4 times the highest level we've ever seen prior to the current crisis, which is bad. On the other hand, it's about 2 million less than we had 3 weeks ago. And so we've gone from 6.5 million new unemployed a couple weeks ago to 5.3 to now 4.4. So the trend line is going well. The problem, of course, is that the 6.3 that were laid off 3 weeks ago are still unemployed. So this is all cumulative. There was also a report out a week or so ago, a couple weeks ago now, that 31% of renters in the United States did not pay the entire rent that was due April 1st. On this note, this report got a lot of play. But as if you read the actual data, about 19% of renters typically don't pay all the rent. So we're about 10% above that. Pardon me. So when we look at what state governments are doing, public schools give us a nice way of, a nice clean criteria that's affecting all the states in the country equally to see how they're responding. And what we see is every school system in the country is shut down. Every public school system, that is. Wyoming is technically shut down to the end of April, but they expect to have this, they don't expect the schools to open up on May 1st or May 4th, the Monday after that. There are about 7-8 states that are technically closed into some date in May. But if you look at the map there, that includes New York and New Jersey and Connecticut, Maryland, Delaware, states that have been hit really hard by the pandemic. And there's just no way most of those public schools are going to open up in May. The vast majority of states, including Alaska and Hawaii, apologize for not including them, are closed for the academic year. A couple states, interestingly, California, one of them, haven't closed. They've placed that decision on the local schools. Now, most of those schools have shut down, but it means that public schools can open kind of sporadically around those states. And then North Dakota is closed until future notice, which means the academic year. These are K through 12 schools. Universities are almost also universally shut down, and they are now debating whether or not they will be able to open up in September. Most public school systems haven't started having those conversations yet because they're trying to get through the next 2 months. Go to the next slide. I want to draw your attention particularly to a headline in a local newspaper in Northern Virginia. Fairfax school system, that's a Fairfax County school system in Northern Virginia, one of the wealthiest school systems in the country, had a very fancy e-learning system that they had set up and they'd implemented, and they bragged nationally that they had this great system that was going to allow them to teach all their kids. And it went online last Monday full time, and it was a complete disaster. And they have since shut it down, and they're going to try something else. And I highlight this to point out something we're learning as a result of the pandemic. Schools, hospitals, universities, a lot of companies had very nice plans in place for dealing with disasters that required them to work remotely. And most of them didn't work. And what we're seeing in the public schools is echoed in a lot of other places. Public school systems had a system. They had a plan for allowing teachers to teach their students if the students couldn't get to school. And this is the first time we tested them, and it didn't work. I can tell you, friends of mine, including my sister, who is an elementary school teacher, pointed out that you simply cannot teach K through about 2, kindergarten, first grade, second graders through a computer if you expect them to do it more than 15 minutes at a time. Little kids just don't sit still for that. And my sister in particular, who is an elementary school teacher, says, what exactly am I supposed to do when I'm teaching 20 kindergartners, first graders in our case, and 2 of them get up and walk away? What exactly am I supposed to do about that? And so we're talking about distance learning for non-college kids. And I understand distance learning at the college level is working much better in most cases. But grades 7 through 12, a lot of work has to be done in how to make this happen. And there's lots of wrinkles and lots of problems with the system that are just now emerging. Learning, for example, the number of our students that don't have decent internet at home, or in many cases, any internet at home. I know I've heard in Northern Virginia, a lot of families, when the kids came back from school, well, both parents still work. And many of them work outside the home, even under the current situation. And even if they work from home, they have to be working, which means the parents can't work with the kids when they're supposed to be learning. 2 implications. One is teachers who aren't physically present it's almost impossible to control the kids. Secondly, a lot of older kids are being forced to become full-time babysitters, which means they can't do schoolwork at the same time. All of this is to say that the country needs to do a lot of work to get better at this remote distance thing. And IEEE members have a role to play in helping figure out how to do that. There's some social problems that we need social scientists to help us solve, but there's also a lot of technical problems that IEEE members should play a role in solving. If we move on to talk a little bit more about what the states are doing, like I said, most states are now having conversations about how to reopen. Doesn't mean they're reopening, it just means they're starting to talk about it. We have here a graph that comes from the New York Times via Yahoo. Excuse me. Most states have a statewide order for individuals to stay home except for essential travel. And what essential travel is differs from state to state, but the basic rule is don't go out. A few states don't, but even the states that don't have that order are still discouraging people from going out and still have pretty strict rules shutting down businesses. States are starting to think about how do we get businesses back open. There's about 18, 19 states that are going to allow some non-essential businesses and activities to reopen by May 6th. Now, a lot of caveats here. There's a huge amount of variation between the states on what is defined as non-essential. Some states are allowing a couple of very specific types of companies to reopen. Other states are saying, okay, broad chunks of the economy can reopen. And many of these states are saying we'll reopen May 4th, May 6th, but as we approach those dates, may extend it. But Arkansas, Colorado, Florida, Georgia, Idaho, Indiana, Maine, Michigan, New Mexico, Mississippi, Missouri, Montana, North Dakota, Ohio, South Carolina, Tennessee, Texas, Utah, and Vermont all expect to allow businesses that are currently closed, not all of them, but some of them, to reopen before May 6th. Now, what's interesting about this list is it's not partisan. Some of these states are very, very red, and some of the states are very, very blue. And some of the other states that are very, very red and very, very blue aren't on this list. Alabama, for example, one of the most Republican states in the country, is not on this list. Vermont, arguably one of the most Democratic states in the country, is on the list. And so we're seeing a really interesting experiment going on here. For example, you see that New Hampshire is not on the list, but Vermont is. New Hampshire being the most Republican state in New England, arguably, Vermont being one of the most liberal states in the country, and they're kind of right next to each other and not big enough to be all that different. So we have a number of these natural experiments that are happening in society and globally, which we'll talk about in a second, which will allow social scientists and other researchers to do some very interesting data analysis moving forward to figure out how various parts of the country and parts of the economy dealt with the current lockdown. So if we go to the next slide, let's look at this information a little bit more detail. One of the areas that is useful to look at are non-essential medical procedures. This is one of the flashpoints that we're seeing. Most states shut down all non-essential medical procedures because there was an expectation that healthcare resources were going to be needed to deal with the coronavirus. As in some places that's starting to fade, a number of states are saying we're going to allow some or all non-essential medical procedures starting on May 1st, or in some cases before then. Arizona, Georgia, Illinois, Kentucky, Oklahoma, Oregon, Utah, and West Virginia. Same time, other states are saying absolutely not. For example, just yesterday evening, the state of Virginia announced it would not allow non-essential medical procedures until mid-May. So we have this interesting different approach. And again, you have some states on this list with some very big urban areas. The pandemic tends to affect urban areas as pandemics historically do, affecting urban areas more than rural areas. But Georgia, of course, you have Atlanta, Arizona has Phoenix, Illinois has Chicago. And so states that have been affected by this, by the pandemic fairly dramatically, are already looking to open up non-medical procedures relatively soon. A number of states have already started to allow outdoor activities, solo outdoor activities. Florida and South Carolina have reopened some, though not all, of their public beaches. Michigan, Minnesota, Tennessee have opened up hiking trails, boating, fishing, golf in some cases. Although I'm not entirely sure who plays golf in Michigan this time of year, but what do I know? Rhode Island, by the way, has announced it will open up its beaches by the end of May. Now that sounds like a long way off, but I grew up right next to Rhode Island in southern Massachusetts, and I can assure you that nobody is on the beach in Rhode Island until the end of May. It's very chilly. A couple states have already announced that they are going to look at reopening their states in pieces. New York, Governor Cuomo has noted that there is clearly a difference in how the pandemic is affecting New York City as opposed to the rest of the state, the nice part of New York and upstate New York. I was born in Syracuse. And so he's already looking at a plan that allows upstate to New York to open up earlier than New York City, which is going to be a while. Missouri has announced that it's developing a plan to allow pretty much all of Missouri that's not Kansas City or St. Louis to start opening up soon, and the two major cities will take a little bit longer. There are two groups of states that are coordinating their reopening activities. One which we'll call the New York sector, although people in Massachusetts will likely hate that. But you got Connecticut, Delaware, Massachusetts, New York, New Jersey, and Rhode Island that are coordinating their response, which makes sense. And then you have the upper Midwest of Indiana, Kentucky, Michigan, Minnesota, Ohio, and Wisconsin that are coordinating their efforts. Now, that doesn't mean all states are doing exactly the same thing, but the governors are working together to allow the whole region to work together on this. Key industries that are being looked at and are kind of part of the debate are not surprising. They're industries or institutions in one case where people have to interact with other people: gyms, restaurants, hairdressers. Dentists are proving to be an interesting flashpoint. I don't quite know why those aren't just lumped in with other non-essential medical procedures, but they are. And then churches, which are complicated for a number of reasons. Interesting little chart here from Utah, which I thought was neat. And a few states have started to develop charts like that. Not a lot of details in the chart that I just showed, but there are details attached to it if you go to the Utah website, clearly laying forward a path to opening up the economy in a staggered way, which I think there's universal agreement is going to be the way it's going to be done. Now, I mentioned a minute ago, we have some interesting natural experiments going on how to deal with a pandemic, where you have regions of people that are ostensibly similar dealing with the pandemic in dramatically different ways. And I think the best example of this is the Nordic countries. Sweden, Norway, Finland, very similar countries, very similar cultures, very similar governments. Sweden is roughly twice the size of Norway and Finland, although Norway's economy on a per person basis is considerably larger. Small differences in the percentage of population that live in urban areas. Tiny differences in the median age. Both, you'd think the percentage of people that live in an urban area will negatively affect their ability to deal with the pandemic, although not necessarily true of South Korea and Taiwan. Older countries you would expect to deal with it less well as well, although not necessarily Japan. But so we have these three countries right next to each other, similar climates, similar societies, similar histories, similar healthcare systems, and we have dramatically different numbers for what's going on. Now, the key difference we have here is that Norway and Finland shut down their country much like the United States and most other countries did. Sweden did not. Sweden refused to order people home. Restaurants stayed open. They told people just be careful. And you can clearly see a difference between the three countries in terms of deaths. Deaths in Sweden are about 10 times higher than Norway and Finland, more or less. Keeping in mind, Sweden has twice the number of people, so we'd expect it to be twice as high, but not 10 times as high. But here's what's interesting. The number of cases in Sweden, Norway, and Finland don't follow that pattern. If you look at Norway, the number of cases in Norway is a little less than half that of Sweden. It's about 40% of that of Sweden. So if you double the number of cases in Norway to make up for the population that's half as big, they're not that far off. Finland, on the other hand, has dramatically fewer cases, and notably fewer cases than Norway, despite being essentially exactly the same size and being notably poorer. I mean, Finland's not a poor country, but it has less money. It also has a older population than Norway and a more urban population than Norway, and yet is doing much better. Now, why is that? Got no idea. But it's going to be interesting over the next several years as social scientists, health scientists, other researchers dig into these numbers to really figure out what happened. And hopefully will be quite enlightening and help us deal with it better if this ever happens again. Next slide. We did have some activity in Washington last week. Technically, Washington was on recess, but they rushed back yesterday to pass the CARES Act Part 2. This doesn't have a bill name. The piece of legislation they passed simply amends the CARES Act that passed a few weeks ago. And what's interesting is that the bill didn't do much. We talked about it last week, where we expected the CARES Act to include additional money for the programs established in the original CARES Act, plus something else. Well, in the end, there was nothing else, which is surprising. What the bill did is it creates another $310 billion for the Paycheck Protection Program, the PPP program. That's loans for small businesses. It creates another $10 billion, or adds another $10 billion to the EIDL program. That's the $10,000 advance on EIDL money, EIDL loans. It did tweak the definition of business to include agricultural businesses, which I was surprised wasn't included in the first iteration of the bill. There's also a big chunk of money in the bill for banks. The way the original CARES Act worked is small business loans were processed through banks that typically handle small business loans, which is fine. The problem is the banks make their money off the interest and fees associated with the loans, but the CARES Act got rid of the interest and fees. And so the banks were saying, hey, listen, you're forcing us to do an enormous amount of work here, and there's no money in it for us. And so Congress put forward a decent chunk of money, several $1 billion, to compensate community banks and smaller lenders, not the big banks, but the smaller banks, for their work on the PPP and EIDL loan programs. The CARES Act, also the one that just passed, has a bunch of money for the various government agencies that are dealing with the pandemic, Health and Human Services, CDC, and the other agencies involved, which we're going to have to kind of do whether we want to do it or not, because they're going to do the work and they're going to have to pay for it. So, but that was really it. A very streamlined bill. It's worth noting that this is almost identical to the bill that failed to pass last week, but it is now done and it is now law. Congress is now starting to turn to the next phase of the Relief Act, and nobody's quite sure what that's going to be. There are a number of longer-term problems, including research, the universities, infrastructure, which are on the table, but it's not clear which of those are going to get heard first. It is clear that none of them are going to be heard until May. So we will know more once Congress gets back on May 6th. Now for some non-pandemic news. A few things in the immigration world that IEEE members will care about. The president has announced an end or a pause, depending on your perspective, to accepting green card applications. So there'll be no new green cards issued for a while. The logic of that is that the United States is facing an unemployment rate of 15+%. Now is not the time to bring in more workers. IEEE-USA's perspective on that is, when we're talking about high-skilled workers, you can never have too many really innovative people. And with an economy that's going to need some innovation, need some infusion of ideas to get going again, locking out top potential skilled workers is not necessarily a good thing to do. There's a second executive order that we are expecting that will put new limits on H-1B visas, specifically asking companies or forcing companies to prove that they continue to need H-1B workers every year. We applaud that. Remember, IEEE-USA draws a very clean line between green cards and guest worker visas. H-1B workers, H-1B visas, that is, don't create American workers. They're used by temporary workers to live in this country for a couple of years, but then typically sent home, as opposed to a green card, which creates an American citizen. We support the green cards and support more green cards. We do not support the H-1B program. There was also a court case last week that is getting a lot of attention. The court ruled that a number of changes the administration had put in place, to the result of which were an increased number of denials for H-1B applications. The court ruled that those changes were invalid. Now, it's important to note why. Excuse me. The court didn't rule that the changes themselves were somehow problematic. The court ruled that the way the administration implemented them was problematic. What the administration did is they used memos, just sort of announcing that things were going to be done differently. This has become an increasingly common tactic in Washington, particularly for administrations, to get things done without going through the formal rulemaking process. Formal rulemaking takes a long time. It requires that the administration open changes up to public comment, and requires the administration to respond to public comment. Administrations have been using memos to avoid the rulemaking process because it's quicker, it's cleaner, you don't have to deal with the public. And the court said in this case, that doesn't work. One of several examples of pushback in the courts to the executive branch basically changing rules on their own. But it's important to note that the ruling was on the narrow procedural issue, not the broader issue of whether the changes themselves were legal. IEEE supported the changes, though personally I understand what the courts are saying. The executive branch shouldn't be making law. It should go through a public comment process first. A little bit of additional news from Washington that is of interest to many IEEE members. You may recall that the United States has a brand new military branch, our 6th branch, called Space Force. Space Force is open, operating, and is now accepting applications. The bad news is that those applications currently are just for people in the military to transfer from one branch to the brand new branch. But any IEEE members in the military who want to become part of Space Force, and let's face it, the Space Force is pretty cool. www.spaceforce.mil is the place to go to apply to make that change. Another thing I want to draw attention to, I mentioned this in a previous update. And since then, I've been reading more, and I really think this is it didn't get a lot of attention in the general press or in the public, but I think this is actually a very big deal. The White House issued an executive order on the recovery and use of space resources. What the executive order did is it clarified that the United States was not bound by the agreement governing the activities and states on the moon and other celestial bodies, also known as the Moon Treaty. That treaty was signed in 1979, although not by the United States and not by most other countries, especially other countries that have space programs. The treaty, the Moon Treaty, said essentially that nobody owns outer space. That outer space exists for the good of humanity, and any benefit from using space has to be shared with all of humanity, which is a lovely sentiment. But the United States then and the administration now has said, no. What this does is it opens the doors for companies to assert property rights for things in outer space, which is important because there are a number of companies in the United States now that have business models, viable potential business models, for putting things outer space to make a profit, mining asteroids, putting robots on Mars, and not Mars, Moon, Mars is down the road a little bit, on the Moon to start mining minerals. Now, yes, at the moment, many of these plans are still kind of in the far distance. They're a little far-fetched, but they're not as far-fetched as they were 10 years ago, and they're coming fairly quickly. And the problem was companies looking to move in that path, to start figuring out ways to make money in outer space, were running into this treaty and the ambiguity it created and said, wait. We're not going to start mining asteroids if we have to share all the money we made with all of humanity, because there'll be nothing left. The administration has clearly signaled that should a company figure out a way to mine an asteroid, that company will be allowed to sell what it digs up or drills or whatever it is for profit and to make money, as any other private company would be willing to do. This is an important legal step for opening up outer space to more routine private exploration and private space travel, which is exciting because, as I said before, if the United States can figure out how to get into outer space at a profit, the whole game of outer space changes. Our entire space-based system, our space policy system, is based on the notion that it's going to cost bajillions of taxpayer dollars to get into outer space. And therefore, that constrains what we can do. If that's not true, the whole calculus begins to change in very exciting ways. I want to go back over our online resources that that IEEE-USA has. IEEE-USA has a number of resources online, webinars, ebooks, professional training programs to help particularly IEEE members who have lost their jobs, and unfortunately there are quite a good number of them. We are available to help folks who have lost their jobs and are looking for new work, so please reach out. The IEEE Foundation continues to raise funds for COVID-related programs. And IEEE Spectrum has actually a very comprehensive website put together of IEEE resources, programs, webinars, other assets and other resources free to IEEE members to help them respond to the current situation. Spectrum has also gathered a good number of stories of IEEE members doing really innovative things to help with the pandemic, which I think deserves recognition. We applaud all the IEEE members who have used their innovation, used their knowledge, used their experience to help local communities, in some cases national healthcare systems, respond to the pandemic, save and change lives. So well done, and you certainly deserve more recognition that we hope you will get in the coming weeks and months. And with that, our next update will be May 7th. That's not next Friday. Got something else going on next Friday. So our next Washington update will be May 7th. Congress will be back by then. Some states might be more open. Some states definitely won't be. So we should have a great deal to talk about. John, do we have any questions? And so if you have any questions, please put them in the chat box. Put them on Facebook. If I see them on Facebook later, I will try to respond to them. Giorgio, of course Space Force is cool. It's the Space Force. It's like the Federation. We're starting it here. I don't know any IEEE members who don't necessarily think that they are Space Force is not cool. Brendan Godfrey, my good friend Brendan, dentists are not necessarily non-essential. It depends on the state. Some states they are, some states they aren't. I know in Virginia they're not. Other states have specific, I have notes. Nope, didn't write that down. Other states are specifically including dentists in the non-essential medical care. And I don't honestly understand why they would from a policy standpoint, because dentist chairs are not going to be used by COVID patients to recover. But a lot of states, they kind of slap restrictions down in a blanket way to capture dentists in ways they shouldn't. And in other cases, dentists were just called businesses. And, you know, because you can't be a dentist without getting very close to another person, they said, no, that's not safe. You can't do it. So the definition of whether dentist is essential, non-essential, open or closed varies widely around the country. And that's why I highlighted it as a way of it's a way of differentiating between the states and how they deal with dentists. Will patent rights be affected by possible ownership stake considerations in space? That is an interesting question. And the answer at the moment is I don't actually know, although the administration clearly is signaling that they would not. The idea is, now the executive order doesn't say this. What the executive order does is it sets up a precedent that will allow the next executive order or court case or law or regulation or whatever comes next to be more definitive about it. But the executive order removed a barrier, a potential obstacle to a company saying, stuff in outer space belongs to us and you can't use it. In theory, the next logical intellectual step from the current executive order is some sort of definitive statement by the US government saying property rights on the Earth are extended to outer space. So property you own on Earth is owned in outer space. And again, we're taking legal steps here. If you make a discovery, if you invent something in outer space, that counts as though you invented it on Earth. Now, there's a lot of complications there, a lot of little wrinkles that need to be worked out. The key thing to note, however, is the administration is clearly and by the way, the Trump administration is doing this. The Obama administration did exactly the same thing. The Obama administration's position on space, and particularly commercializing space, is almost identical to the Trump administration's. Both administrations are pointing the US government towards a goal that will recognize property rights in outer space exactly as we represent them on Earth, which we think is a good thing. IEEE-USA has a position on that, and we've been in favor of the commercialization of space for a very, good number of years. Okay, I don't see anything else. As I said, if you have any questions that come up, you can paste them to Facebook if you're on Facebook, or communicate with me directly, r.t.harrison@ieee.org. My direct phone number is 202-530-8326, which I will get even if I'm not in the office, which I generally am not. And with that, thank you. Hope you and your families all remain safe, and I look forward to speaking with you again in a couple weeks. Thanks.